Dr Andrew Preston is with us, microbiologist at the University of Bath. Andrew, very good morning to you.
Good morning, Mike.
Thanks very much indeed for joining us. We are in a pretty good place, it would seem, at the moment. There are some still saying that, we have to be careful, we have to be cautious, we have to be worried. What would be the reason for having a third jab if you've already had two?
Well, we still don't know exactly how long that protective immunity might last from the second jab. We just don't know. So I think rather than saying we're definitely going to have the booster jabs, I would say this is probably precaution, putting everything in place in case they are required. And importantly, I think there is trials underway, and the initial data is suggestive that actually there's two. This comes down to how to tackle variants if the need arises in the future. So obviously we've talked a lot about having new versions of the vaccines that incorporate those variants in, but actually there's a growing body of sort of optimism that actually a third jab with the existing vaccines can actually top up the immunity sufficiently that you still get excellent protection even against some of these more worrisome variants.
Well, what we don't hear too much about these days, Andrew, is what we used to hear a lot about, which was if you've had the coronavirus, regardless of how seriously or otherwise you've had it, it's very unlikely you'd get it again.
To be honest, I don't think the data is particularly solid on that one. There is evidence of reinfection, but again, you're right in that it would be surprising if there was no effect of previous infection. But again, I think something that's not really well recognized is that vaccine-mediated immunity is not just mimicking natural infection. A lot of these pathogens have strategies to limit the effect by which they're excluded from their host by previous infection as a way of maintaining themselves in the population. So whilst we talk a lot about comparing the immunity from natural infection with that from vaccines, they are two distinct things, and in many ways we aim to sort of do better than natural protection when we use vaccines.
Yeah.
So they're not exactly equitable.
No, but there are many paths to immunity, aren't there? I suppose.
Well, to be honest, no, not really. It's about stimulating a protective immune response, and that's going to involve, we think, for this virus, some key neutralizing antibodies and probably some T-cell involvement in terms of the actual mechanisms. So it's still about presenting parts of the coronavirus to our immune system in a way where then the immune system is set up to recognize it again in the future if it gets a second encounter.
Right. But if there's only one path to immunity, or there's only one way to get it, why do people's experiences differ so much then? Because there's so many people who get it hardly badly at all. Lots of people who get it and are very ill. Lots of people who get it and then suffer from it for quite a long time afterwards. Other people who get it and have no symptoms at all. I mean, it seems to be a very wide range of different effects from coronavirus that I certainly haven't seen with anything else.
Well, actually, it's not that unusual to get that degree of variation. We see it with common colds and many other infections. So, I mean, again, it's that distinction between what we're talking about in terms of preventative immunity from vaccines. You can get that through natural infection, but unfortunately, you have to go through the infection first. So, what we're talking about, previously a few moments ago, was pre-existing immunity that can block an infection. What you're quite rightly pointing out is this wide spectrum of symptoms is actually what happens whilst that immunity is building.
Right.
And so that's really the body's overall response to the virus whilst that immune response is kicking in. That really takes, we've seen from the vaccine, takes a good 3 weeks to establish. So it's really during those early weeks where we see that wide spectrum of consequences, I guess.
Yeah. I mean, I always ask this question as well to different doctors that I get on. Is it the case that, yes, the vaccine is working terribly well, and it's much less likely that you will become sick and or be admitted to hospital now if you've had that vaccine? But it also seems to me that with this statistic this morning that only one case in 10,000 in the over 60s in London, it seems to me that there isn't much virus around at the moment.
No, you're quite right. Clearly, the amount of virus in the population has dropped dramatically. Some of that has been down to the lockdown that is now easing, but also, the emerging data is that the vaccination does help to actually reduce transmission. We're not exactly sure how much early data, but again, we only really have early data from a particular sort of age category, and that will vary according to age groups. So maybe a sort of 30 to 40% reduction in transmission. So as we then, of course, stretch the vaccine across the population, that will have more and more of an effect. But I think we're seeing sort of cases at the moment sort of bottoming out really, or sort of remaining stubbornly around the 2,000. So maybe this is as good as it gets, in which case we now have to deal with this and learn how to go forward with that level.
Because if those 2,000 cases are also mild cases, then surely that should be quite an important milestone as well, rather than just calling them 2,000 cases as if they were 2,000 cases that we had in January, which would have been much more serious.
No, you're absolutely right. And again, if those 2,000 cases are much less able to pass it on to more people, but that's exactly what we were hoping from vaccines, that even if it couldn't eradicate the virus, it would turn it into something that is no longer really this critical issue in terms of health and all the consequences of that. And the data for that is looking very good.
Yeah.
It's really, yeah.
And I don't know whether you know the answer to this, but what's the situation or what the picture is like in other European countries? Because obviously we saw in Germany that they were getting, after we sort of had the worst January, they were getting it a little bit later on. Same with France. What's going on there?
I think possibly, whereas for much of the pandemic we were always sort of considered to be 2-3 weeks behind Italy, behind Spain in terms of the trajectory, I think possibly they're maybe 2 to 3 months now behind where we were in January.
Right.
So it's certainly the so-called Kent variant has really driven much of the wave that's being experienced it's certainly in Western Europe. India maybe slightly differently, and of course they're really sort of where we were January, February time in terms of the vaccine rollout. So they've had that sort of very low vaccination rates just at the time when they're suffering the peak of infection, so much as we did in January. So I suspect, give it another 2 to 3 months, then I very much hope that most of the countries where we have close contact and looking for international travel will be in the situation that we are in now.
But it can't be an accident that our vaccine rollout has been an awful lot better than the rest of Europe's, and that's also a factor.
No, I don't think it is an accident at all. You've seen the scale of what was required. So undoubtedly there was a very rather unusually for everything that's happened, a very, very fast, streamlined, bold approach. So we bought up vaccines very early on. We really sort of hedged our bets in that we purchased many doses of each type of vaccine platform. So don't forget, these decisions were being made by the Vaccine Task Force at a time where we had no idea whether any vaccine was going to be effective, certainly had no clue how effective it was going to be. And they covered all the bases. So the mRNA vaccines, the viral vector vaccines, such as the Oxford AstraZeneca one, and some more traditional ones that are still to come online, the Valneva and Novavax. So it was a really, enlightened but perhaps risky approach.
Yes, well, there you go. Sometimes being risk averse isn't always the best way to be. And what about we've opened up hospitality now, albeit outside, for over a couple of weeks, and normally we're told that's the lag time for any sort of fresh infections and peaks and things like that coming through. It doesn't appear to be any problem out there at the moment. No, I think the first test was the reopening of schools. We held our breath slightly on that one, but actually the much maligned testing program I think probably did help. And of course, that was off the back of a pretty effective lockdown. I mean, outdoors, the risk of transmission is clearly much lower than indoors. So we'll see what happens when hospitality opens indoors from May the 17th. But hopefully we're at a time now where, as we just discussed, the level of virus amongst people visiting hospitality is much lower. And seasonally, probably there's fewer things that will help transmit in terms of environmental conditions and perhaps other respiratory infections that increase our viral output. So I think we're looking good for summer, and then almost inevitably eyes will start to move forward to perhaps any rebound that we might experience in winter, which will be the result of any seasonal rebound plus any importation of cases from international travel over the summer. Yeah, I mean, there's still an awful lot of people travelling. I was talking to a travel expert the other day who had just come back from Mexico, where he'd gone to a travel conference, and he said he went out to Cancun on a British Airways flight from London, which was 60% full. Now, they weren't all going to a travel conference. So, I mean, we've never really had sort of zero in and out international travel anyway.
No, we haven't. But again, it's a bit like the lockdown. It was never as if every single person in the country was stayed in their house for 2 months. We still have the so-called essential sectors open. I think that you're right, though. It has been surprising just how many daily arrivals there has been when we thought we were completely locked down. But it's still a drop in the ocean compared to the numbers that we get going through under the normal circumstances, particularly during the summer travel period. So that will amplify any effect.
Sure. Well, Dr. Andrew Preston, thank you very much for talking to us, microbiologist at the University of Bath. The question I'm